So I'm going to be talking about labor coaching and labor support during labor and delivery. So I understand that there are three different stages of labor. In the first stage, it includes the latent phase, active phase, and transition phase. In the latent phase, the frequency is 5 to 30 minutes, and then duration lasts 30 to 45 seconds. So at this time, the mother's usually home. Her contractions are irregular, mild, and at this point, she should be able to, relax and cope with the pain because the contractions aren't that bad. You would encourage comfort measures such as relaxation and rest at this phase. Support from her significant other is also another comfort measure as well. You would encourage her to do comfort measures such as taking showers or baths during this latent phase. She's also advised possibly to go for a walk, and encourage position changes in this phase as well. You want to make sure that she's ready to go to the hospital because she is home at this phase. So another comfort measure for her could possibly be to start preparing her bag for labor to go to the hospital, and also encourage her to take slow and relaxing deep breaths during each of her contractions as well. So in the active phase, the contractions are more regular and strong. The frequency lasts 3 to 5 minutes and duration is about 40 to 70 seconds. So in this phase, the contractions are much stronger, longer, and painful. She may feel a lot of pressure in her back. So we can encourage the father at this point, to apply, pressure to her lower back, massaging her as well. You can also encourage her, to walk up and down in the hospital, possibly. You want her to be relaxed during each contractions and not to think too much. So, relaxation, distraction, possibly soft music. The lights can be dimmer at this point. She may be encouraged to drink water or fluids, but not a lot of solid foods. So she could possibly maybe still have the ice chips at this point if it's recommended by her physician. She can also have pain medication or epidural at this point, since her contractions are 4 to 7 centimeters at this point. So she can have some type of epidural to help with her pain relief if it's a part of her birthing plan. You can also encourage her to go to the bathroom, which can alleviate pressure from her bladder and the uterus if the baby's head is starting to move down. And, you just want to tell her to, have deep breathing exercises as well. And if she is feeling like she needs to push, we can notify the provider because she cannot push if she's not fully dilated or contracted, or her cervix is not fully dilated or effaced at this point. So, yeah. Then for transition phase as well, we also want to encourage her to use a lot of deep breathing exercises as well. Massaging, rubbing her belly, doing light massages like effleurage massages, light palpitations on her abdomen to relieve some pain from her abdomen as well. Encourage her to breathe. At this point, you want to make sure that she's relaxed and she's breathing as well. And then once she moves on to the second stage of labor, she will be fully dilated. She'll be at 7 to 10 centimeters contractions, and the contractions will be like every 1 to 2 minutes at this point. So you want to let her know, squatting, sitting, kneeling, or laying back are good positions to make her feel comfortable. Whatever position is comfortable for her at this point is what you want her to be in. You want to try new positions as well at this point. You also want to make sure that she can use the different exercise ball too to help with the crowding and pushing down the baby in the engagement phase as well to the pelvis at this point. Just encouraging her and letting her know, she shouldn't give up and she's doing a really great job in this process. Letting her know that she has a lot of support from the physicians, the nurses, her spouse as well. Also helping her with deep breathing and pushing during those contractions at this point, because this is obviously the labor phase and the birth of the baby. So we want to make sure that, you know, when the contractions are coming, we want to make sure that we're monitoring the contractions in the second stage of labor. And then in the third phase, when she is giving birth to the placenta, you know, we want to make sure that she is recovering at this point, you know, and just making sure that the contractions are close together and not as painful. We want to make sure that, you know, the provider squeezes and pushes the belly to make sure that the uterus is in the right position. And, you know, at this point, after she's given birth to a baby, we want to give her skin-to-skin contact with the baby, making sure that, you know, that she's feeling her newborn, and this is a very exciting period for her. So you want to make sure that, you know, you patting her on the back and, you know, encouraging her and telling her that she did a lot of hard work and she made it through the childbirth phase, which is a very exciting moment for her. And then within the first hour, another comfort measure for her during the third stage of labor is to breastfeed her baby. You want to have that connection with her baby, you know, give them an enjoyable moment, make sure that she's warm and, you know, she's not uncomfortable. Making sure that the environment is very stable for her as far as temperature. Holding her baby, you want to teach her how to hold her baby and also how to breastfeed. And these can be comfort measures for her to, you know, alleviate from the stress of having her baby as well. So now on to identifying for birthing positions and identify the advantages and disadvantages of these stages. So 1 second. So one birthing position that she can do is the hands and knees phase. So the pros of it would be getting to reduce back pain during labor and helping with gravity, and also, you know, helping the baby rotate into the right position for labor, making sure that you know, that the baby is not in a posterior position and that the occiput is what is descending down into the pelvis. Cons could be she may be trying to learn and adjust to this hands and knees phase, so bending might be a little bit difficult for her in this position phase, and she may need support during her contractions when she's in the hands and knees phase. Also, another birthing phase for her could be sitting, and the sitting position. Pros could be that she may feel comfortable in this phase because the baby is obviously descending into the pelvis. This is possibly encouraged during the second phase of labor, and can help with alleviating pain from her back, her lower back. But cons could possibly be this position could cause like any type of prenatal trauma, something like that, and it could lead to swelling of the prenatal area if she's sitting for too long, and you also want to reduce the tear of the episiotomy also if she's in the sitting phase. So now we would want to possibly encourage her to do the laying on her side, on the left lateral side, because this could alleviate pressure from her vena cava and cause tissue perfusion, especially after she's had an epidural. You want to help with her laying on her side because she could possibly be tired. So this would be a con for her because side laying position can help with, you know, releasing pain, especially after she's had her epidural. We want her to remain in bed rest as well. And a con for this laying side position could be this position can feel quite uncomfortable maybe for her, and it can may possibly not help with the gravity after or during labor. Another position for her could be the squatting position, sorry. She can stand and squat. This can help, a con with this could be helping with cervical gravity, and it helps the baby descend down into the pelvis as well. And it can help with reducing pain as well, and it's more comfortable for her. But a con could be it could get very tiring very quickly, and it can cause the position or the blood to increase or have an increased loss of blood during this phase. So also another position could be a back lying position during after um a lithotomy. So she could be sitting in a supine position, which helps with the hips flexation. But a con can be, it could be comfortable for her. The doctor can assist her in this position as well, and the position can be correcting, helping her shoulder distortions as well if she's having shoulder distortions. And in any of these positions as well, the nurse can help with Leopold maneuvers, helping the baby, finding out the fetal lie, the position, and the attitude, which can also assist with the labor phase and help with comfort and the birthing positions as well. And a con for the back laying position, can go against gravity as well, and this can cause pressure to the tailbone of the mother as well. So obviously the purpose of the labor coach is to help with, assisting the mother during the phase of labor and delivery. We can have people such as the doulas and the midwives and things like that can help with, helping the mother feel very comfortable in this part of delivery. It's very uncomfortable for her when she's having a lot of contractions. So, also another comfort measure, is indicating the vaginal examinations and making sure that, the cervix is dilating and facing at this point of labor during her stages of labor, because the stages of labor indicate the cervix and dilation and the effacement. You want to make sure that, she's effaced at a certain point and she's not pushing or bearing down when she's not supposed to, because this can cause complications. So we just want to be educating her, as much as possible to help with these comfort measures, letting her know that she's doing a really good job, and also encouraging her and telling her not to give up, because, especially like the transition phase, she can feel like she's having nausea and vomiting. So, we want to let her know that this is normal, and encourage her to let her know that if she needs any type of support, or she feels like she's going to throw up, or she needs to possibly go to the bathroom, or, go to the bathroom during her transition phase, which is also common. We want to clean the perineal area as well, making sure that she is clean and she's feeling supported and warm, and help with hydration as well when she's able to have a little bit of water or like ice cubes and things like that. And making sure that the doctor is notified when she's having a lot of pain. So if epidural is in her birthing plan, it could be a part of helping her comfort measures during labor and delivery, with having pain medications that she feels comfortable having, as long as that she's within a certain point of dilation, like within like 5 centimeters, 4 to 5 centimeters, and she's able to have epidural, just making sure that she's okay. Things that they can also use is like the ball, the medicine, like the big ball that she can use. She can squat over the ball. She can be in sitting position and over the ball, and just having somebody rub her lower back when she's over the ball, or having her legs spread apart with her toes on the floor, making sure that the gravity is helping with pushing the baby down, and using the ball, the medicine ball, to move side to side, when she's having her contractions and she's breathing, to help with her breathing as well. But we also want to encourage breathing, helping her expand, inhaling and then exhaling as well. Inhaling so that she's having moderate breathing, and helping her with filling up the air within her abdomen, so we have a lot of air in the abdomen to help with those contractions when she's having it, and monitoring her contractions, and also monitoring her when she's pushing, and making sure that the pelvic floor is preparing for crowning. But breathing is definitely a good technique for her at this point. Hydrotherapy is also a good point for her. Aromatherapy, relaxation, dimming the lights at this point, distraction, effleurage, and different things like that will help her with labor and comfort during this time of labor.